The first place I want to start is I'm in a state of being thankful. Thankful that I found CPS. Thankful that I took the trip over to India, even though it was quite an adventure. But the results have been great, and I'd like to say where it all started. So I've had gynecomastia for most of my life. I mean, I didn't even know it had a word or a name for it. I thought it was just pretty much fat. So after a while, you get accustomed, you start to buy certain clothes, you stay away from other types of clothes, and you just live your life. Fast forward a little bit, as you get older, it becomes more prominent. Your chest does not feel, male. It starts to feel more female. You gain weight as you get older. And I lived with it some more. I even started to buy certain compression vests that would eliminate it when it was being worn. But I started to get serious about it or even research it earlier this year in 2024 when my daughter, who was 8 years old, asked me the question, and it kind of dawned on me. She asked me, "Daddy, why don't you take your shirt off at the beach or the pool like I see other boys?" So at that point, I realized, wow, as a father, I had never been without a shirt in front of my own daughter, either at the beach or at a pool. So at that stage, I said, well, look, how is it that I'm going to live my life with a daughter and be so ashamed of this condition that I've never even been fully bare chested around her? She's 8 years old. So I started to look deeper into it. That's when I saw that it had become almost an epidemic in male environments. Like many people were suffering from gynecomastia. Now, initially, what you find are males with very minor cases, and they kind of blow it out of proportion, right? So certain people, you see them and they say, oh, I hate my gynecomastia or I hate my chest. And for me, it was like, well, I wish I had yours because my stage was very, very extreme. And that's when I started to realize that there were different grades of it: grade 1, grade 2, grade 3, grade 4. And most cases are grade 1 and 2. Grade 3 and 4, to which I was a grade 4, that's the most extreme and the more rare cases. Now, looking at different plastic surgeons in the US, they all promote their method of the procedure and their method of the treatment. But 85 to 90% of the cases that they treat in the US that they promote are like grade 1 and grade 2. Very obvious, but more simple procedures. When you start to get into grade 3 and grade 4, larger breast where it's very obvious, can't hide it, that's where most plastic surgeons in the US shy away from. And the ones that do take on those cases, they create what they call a double mastectomy. They totally scar your chest from left to right under both breasts and remove everything that's there, sew it back up, and graft the nipple. And what that means is it just kind of cuts out everything and kind of makes it like a false chest. And some of the images that I saw from those, it was like I was trading one problem for the next. It's like, okay, you have gynecomastia, then it goes away, but then you have these huge scars at that point. And that's because most of the surgeons in the US, not all, but most that I saw, only did that one procedure when it came to grade 3 and grade 4. So once I knew it had a measure or a scale, I started to research grade 4 gynecomastia. What surgeons were doing grade 4 gynecomastia. And that's when I came across Chennai Plastic Surgery. And Dr. Karthik Ram wasn't only doing grade 3 and 4, he was almost promoting and specializing his method of handling it, because his method didn't involve the large double mastectomy scars. So I watched a bunch of his videos, watched a bunch of his methods of how he would actually handle the patients, and I was like, okay, let me see if I can find someone doing it like this. Because I realized Chennai Plastic Surgery is all the way in India. So I said, well, maybe somebody in the US is doing it like this. And lo and behold, there wasn't very many at all doing it in the US following his method. You may see one or two, and they just were not specializing in it. So before I took the trip, I reached out to another plastic surgeon in Texas and sent him the pictures, started communication. He saw me, we spoke a bit, and then his reaction was, oh, that's very severe, double mastectomy. You must do the nipple graft. So he went all the way down the path of the most extreme procedure, the double mastectomy. And everybody was saying the same thing. So I was like, wow, this is more of a standard practice in the US rather than trying it in the way that I saw Chennai doing it. So I said, okay, let me reach out to Chennai Plastic Surgery and see if I can at least get more information, because at the very least, I didn't even think I would travel all the way to India to have the procedure done, much less even, be here talking to you right now. So I reached out and I sent them an email, and in about a day or two, they responded. And then also I sent them a message on WhatsApp. And the message on WhatsApp, they probably replied like within 2 hours or 3 hours. And I was amazed. So it was a lot of quick interaction and quick responses. They immediately asked me to send pictures and asked me by, age, weight, height, etc. So I was like, wow, this is kind of moving fast. I figured I wouldn't hear back from them for weeks, but now everything started to happen in very short time. And to give you an idea of that timeline, I reached out to Chennai Plastic Surgery middle to the late July and was able to get a date scheduled for August 19th. So keep in mind, other surgeons were pushing me out 3 months, 6 months for surgery. Chennai, via virtual WhatsApp and email, were able to assess me, read my labs, and give me a date for surgery probably less than 2 weeks after we first made contact. So I really was shocked at the pace it was moving. I was even wondering if it's real, right? So at that point, wondering if it's real, wondering if it's a scam, they didn't ask for any money yet. They were just kind of just talking to me. Dr. Karthik Ram sent me a message on WhatsApp talking to me, explaining what he saw in my case, explaining his procedure, the methods that he would take, and sent me even some more videos on how he approached grade 4 gynecomastia, which is the most extreme case. So from there, I was amazed. Like, this guy called me himself. He called me himself, spoke to me. I sent him a message back, and he sent me another one back. And I was like, wow. So I got my labs done, sent them in. And the one thing I was concerned about, amongst everything else, was the anesthesia. I was like, okay, I had never done surgery before in my life, never even pulled a tooth, not a sprained ankle, no, broken leg, no anesthesia whatsoever. So this would be my first surgery ever, and I'm considering taking it on the other side of the world. So anxiety is through the roof. So fast forward a bit, it comes down to Chennai giving me the date. Um, I told them about the anesthesia concerns. They told me they had one of the best anesthesiologists here. They sent me some videos. And then the next thing I knew, I was booking a flight to India and, got the visa. I required an e-visa coming from the US. And it was 18 hours flying from, Florida to Philadelphia, Philadelphia to Qatar, Qatar to Chennai, India. And the whole trip, I slept, but the whole way I'm thinking, where am I going? I am going on the other side of the world to take this massive surgery, right? But either way, leading up to this flight, Chennai was in contact with me on a regular basis, sending me texts. They even sent me a listing of places to stay. Actually, where I'm staying now, it's just about a 5 or 10 minute walk, depending on how fast you walk, from Chennai Plastic Surgery. And Chennai Plastic Surgery is right across the street from the hospital where the procedure takes place. So I got here on the Saturday. I left the US the Thursday and arrived in Chennai Saturday 2 a.m. And it was just a total adventure. The people in India are very nice. Everybody is very friendly. And I couldn't say more about it. If I had to take away anything about India, it would be the people and the food. Great people and great food. And that also held true for the staff at Chennai Plastic Surgery. The sisters, which they call the sisters in the US, we call them nurses, but the sisters here was phenomenal. I mean, up until this day, they are very helpful, very caring. You know, even some, if they don't speak English, they caring doesn't have a language. You just know how to do it. If you care about somebody and you care about a patient, even though there's a language barrier, you can know how to make them feel comfortable. And that's what, the sisters here have done. Dr. Karthik Ram, by the time I met him in person, he felt like a celebrity to me. I had watched all the videos, watched all the different procedures. And as he is on the videos, he is even more so welcoming in person. It almost felt like I knew him from before. I was like, you know what, maybe it's because I watched all the videos. But it was his approach and his attitude of caring and letting me know that everything would be okay that really stuck with me and solidified my decision to come to India. I mean, I couldn't have made a better decision. And fast forward to the day of the procedure, I had certain issues on the blood pressure side because number one, I arrived on Saturday. The procedure was scheduled for the Monday. I was jet lagged, nervous, anxiety, first surgery, different country, other side of the world, all these things. So my blood pressure was high. So they didn't proceed with the procedure that day. And I was very nervous because I was like, wow, what if they have to push it off till another week, till another month? And I just was here and it wouldn't happen. So I came all the way to the other side of the world and wasn't able to get the procedure. But lo and behold, Dr. Karthik recommended me to a cardiologist here in the same hospital. And they treated me like I was a patient that was here all the time. They did the EKG, told me everything was fine. He even gave me recommendations like, well, sir, you got to lose some weight, which I knew. But it was the type of interaction and personable approach to healing that they have here that is totally different from the US. This cardiologist had never known me before. I was not a patient of his before, but he was able to treat me, get my blood pressure under control that Monday and Tuesday. And they didn't even want to let me leave until it was more stable than when I got in. So I wasn't able to do the surgery on Monday, but I did come back on Wednesday with good blood pressure. The cardiologist gave me a prescription to take. And from then till now, I've been great. Now, the day of the procedure, again, nervous, but still very comfortable because everybody is very welcoming. The anesthesiologist, and the last thing I remember is them putting on the mask and asking me what music to play and then telling me to take a deep breath and think about something nice because that's what you're going to wake up thinking. So I was like, again, what is going on? But as the gas turned on, I fell totally to sleep. And the next thing I knew, he's asking me to, hey, Mr. Michael, open your eyes, wake up. And they were done. So that was like, go to sleep and wake up. It feels like time passes. I really don't even know how long I was under, but it just felt like a minute or 2 minutes, and you wake up and the procedure is finished. And they're wheeling me away and, making me feel happy, telling me I can wear a t-shirt now, which I was laughing. And it was very good. I spent about one night in the hospital because they wanted me to be there for observation. Again, first time having a surgery, first time under general anesthesia, totally out. And on the other side of the country, they knew I came here alone. And this was Dr. Karthik's words. He said, I know you're here alone, so I'm going to recommend you stay a night in the hospital for observation. And they brought me food, lunch, dinner, breakfast. And then the next day he came, they saw me, we looked at the results, and it was phenomenal. I mean, it was overwhelming. And it wasn't just the results, it was just the approach. Many surgeons can do surgery, like the mechanics of surgery. But the mechanics of surgery aren't healing. The healing comes after. The healing comes after with the interaction with the patient, what you do after the procedure is done. And Dr. Karthik and his team are top notch. I mean, I wish I could take them with me to the US and really show some of the doctors and surgeons there a different side of healing, because in the States, some of them are so overwhelmed. Again, not all. We have some great doctors, but they miss that person to person approach. And I couldn't have felt more comfortable coming all the way to this side of the world, being invited, feeling like family, and still getting top notch care and treatment. So, my recommendation to anybody is, I understand it would be, very nerve wracking to take such a long trip from the US to India to do this procedure. But if you can, I would say do it. If you, honestly, it's even cheaper than doing it in the US. If you have the funds to do it in the US, I would say take the trip over to India. It's a great adventure. Have great food, meet great people, and have the procedure here in India. I can't say that enough. I'm planning to come back to India just on a different trip as a tourist to really see the place some more. But this has been a very memorable experience for me. I was in the hotel earlier today, wondering like, wow, I'm going to be leaving next week, and feeling kind of sad about it because the whole environment has been great, from the hotel staff to the hospital staff to Chennai Plastic Surgery. It's been one end-to-end experience. It's almost like I wonder if they're all working together. So it's been a great experience. My results are great. I'm still in the healing process. It's just a little over a week since the procedure, but I can see the great results, and it's far better than it was before. I'm excited to go back to the US, hang out with my daughter. I have a commitment that at least by next summer, we're going to be in the pool with shirts off, hanging out or at the beach, more free, not spending a lot of time and energy fluffing my shirt or worrying about who's seeing, gynecomastia male breasts, but now being more mentally free and happier. So, I look forward to that. And this has been an experience that I won't forget whatsoever.